Are pain injections worth it to help hip arthritis? Well, it depends on what your goal is from getting these injections. Are you looking to get some temporary relief? Or are you looking for this to take away your pain for good? Or are you looking to get the type of injection that's supposed to help you with getting more cartilage cells into your hip joint? I'll give you answers to all of these questions, but first you need to know that there's 4 types of injections that you can get for hip osteoarthritis. The first one is a corticosteroid injection. That's what you hear about, the steroid injection, the most common one. The second is a hyaluronic acid injection, which is the gel cushion injection. The third is going to be your PRP injections, which PRP stands for platelet-rich plasma. I'll explain this to you. And then the fourth one is going to be stem cells, of course, the newest thing that everybody's talking about. They each have different goals, and that's why I asked those questions earlier. What's your goal with getting these injections? Now, for the first one, the corticosteroid injections, for short, you'll hear doctors or other people say that I got a steroid injection, or I can offer you a steroid injection. There's different drugs that are used. There's a bunch of different varieties, and they even use combinations or cocktails of drugs, as the doctors might say. And they're usually an anti-inflammatory drug and a pain relieving drug, or a numbing agent is what the doctors will say. So it's a pain reliever and an anti-inflammation drug that are combined and injected at the same time. The pain relief effects from a corticosteroid injection can last anywhere from a few weeks to even a few months, 3 or 4 months on the long end, and they tend to be very effective. Now, there are cases where people get injections and they say, didn't do a thing, I was just in pain from the injection itself, and then I was still hurting the same afterwards. You do hear that happen, but you hear most people say, oh, that injection was a miracle. I felt no pain afterwards for several weeks, and then it kind of came back after some time. But it's a big change compared to taking oral medications, pain medications, like taking your Tylenol, Advil, your NSAIDs, those types of oral medications don't have as strong as an effect as an injected pain medication. And what you need to understand about this injection is that it does not address the root problem of hip arthritis. When I gesture like this, I'm talking about the ball and the socket joint. It is caused by a mechanical problem, a muscle imbalance that's causing too much pressure to go through the hip joint. And this type of injection does not clear up the pressure. It does not resolve the muscle imbalance. It just numbs the pain or brings the pain down or takes it away completely for a short time. Now, there are some side effects of corticosteroid injections. We know that if you have too many injections too soon, that it can actually break down certain tissues like ligaments and tendons and even affect the bone. But it takes several of these injections, but doctors will just limit you to having 3 per year. So they'll tell you, after a few months, if this injection wears off, you can come back and get another one, or some patients will just go back and get one. But what they're hoping is that your pain won't come back for a long time because you kind of got over it and the pain injection just helped you get to the rough part of it. But meanwhile, it's very possible that the root problem is still there, just a little dormant. You're not as irritated in the joint, and it wasn't the injection that took away the pain. It was just that it calmed down, but you still have a problem there that needs to be dealt with, some mechanical issue in your hip joint. And so you're not out of the clear yet. You haven't gotten to a safe spot just yet. Now, the second injection that I mentioned is hyaluronic acid injection. They used to call this rooster comb injections because the rooster comb, the little red spiky things on the top of the roosters, that's where they originally started getting this from. Now it's made in a lab. They're usually synthetic hyaluronic acid. And the point of this is it's supposed to mimic the same fluid that's inside of your joint. It's called synovial fluid. There's a lot of hyaluronic acid inside of it because that's supposed to help the cartilage inside of a joint. So part of that is to add good stuff to the joint that might help the cartilage heal, but they're also trying to add some extra fluid to the joint in an effort to cushion the ball and the socket. So they may suggest this, especially if you have bone-on-bone hip arthritis and you're trying to avoid surgery. They may say, well, we can try gel injections, or they really mean hyaluronic acid injections to put some space in the joint and see if that improves the lubrication of the joint, the mobility of the joint, and overall the pain in the joint. But the effects of this are short-lived. You're going to get just a few weeks to maybe a few months of relief. And the doctor will usually tell you might need to come back for several of these injections over the course of months or maybe even a year. And again, like the corticosteroid injections, this is not addressing the muscle imbalance. It potentially improves the mechanics at the joint by making it more lubricated, but if you still have an imbalance of muscle strength around your hip joint, it's usually the muscles in the front of the hip that are too strong and the muscles in the back that are too weak. That if that's not fixed, then you're going to eventually create that compressive force again through the hip joint. The third injection is those PRP injections, the platelet-rich plasma injections. In order to get this injection, you have to have your blood drawn at the doctor's office. Then they put it in a centrifuge, which is a machine that spins your blood in a circle for a little while, and it separates the blood into the platelets and the rest of the stuff. And then those platelets are re-injected into your joint, your hip joint. And the idea is that it's in those platelets that you have a lot of things that help the cartilage to heal. It also might add some lubrication. So that might be the reason that the doctor will ask to give this to you. Now, the research is all over the place with this. It's just new, so there isn't a whole lot of research on it. Some people benefit. I've seen patients that come in that said, yeah, they had a big improvement with PRP injections. And I've had other patients that said it didn't do anything for them and it was an expensive treatment that didn't go anywhere, but they tried it out and saw if it worked for them or not. Again, it's not treating the root cause of the problem. They're looking to just try to heal the cartilage that may be damaged inside the hip joint and potentially add some lubrication to the joint. And the fourth type of injection is going to be your stem cell injections. This is going to be the new thing that everybody's talking about, because the idea with this is you're putting cells that have not yet become a specific type of cell. They're generalized cells that have the potential to become a certain type of cell. So the idea is that if they inject these into your hip joint, that you can add some cartilage cells, that they'll morph into a cartilage cell, and you can add a layer of cartilage to your hip joint where you may have issues with the cartilage there. Now, this is very cool. They haven't really figured out how to make it happen consistently. Where the stem cells are coming from is controversial. That's a video for another day. There's a lot of different issues surrounding the stem cell process. I have seen patients that have had stem cell injections, and some have said that it was very successful for them, and others have said that it did nothing for them. I feel like it's kind of in the same boat as PRP injections. But it still doesn't solve the root problem. And going back to that root problem, that mechanical compressive force, here's what I tell my patients that are asking me, should I go get the PRP injections or the stem cell injections? I tell them it may help you. It might be beneficial in the short term. You still have to address that root problem to get the long-term benefits so that you're not having to go back for those injections on a consistent basis like the doctors tell you that you need. And even if you do lay down new cartilage or you do add lubrication to the joint, it's only going to be short-lived, because those compressive forces are going to squash those new cartilage cells, or it's going to squash the hydration out of the cartilage that you just lubricated, because you haven't fixed that underlying root problem. That's something that a specialist like myself can help you with. I help people avoid hip replacement surgery by treating the root cause of hip arthritis. And I've got a whole treatment approach that walks people through this process step by step. I put it into a program. It's called the Hip Arthritis Recovery Program, and you can access it right now. There's a link down in the description below that will send you to a page that has more information about the Hip Arthritis Recovery Program. I've used this process with the patients here in my clinic so many times to help them get off the surgeon's schedule to have their hip replaced. We tell them, hold off, let's start this process, and then as they get better, they say, hey, I'm feeling so much better, I think I'm going to cancel my surgery. And they are getting so much better that they're getting back to doing normal things. They're not living with some pain still. I mean, they are thriving, because we take that pressure off the joint and it gives the joint an opportunity to heal. So even if you do those injections, that's cool. It may help you out. It may get you some pain relief, may even get you some new cartilage depending on if it works or not. But you need to make sure that you decompress the joint, because that is the root problem. That's what I help people out with. Now, I've got a bunch of other videos here on YouTube that help you with hip arthritis problems, tips, advice, exercises, a bunch of different stuff. They're in a playlist called the Hip Arthritis Help Playlist, and you'll find a link down in the description below for that too. Hey, thanks so much for watching. If this helped you out, give us a thumbs up. Please share this with somebody you think needs to hear this, somebody who's looking about injections for hip arthritis. Don't forget to comment on here. Let us know if you had these injections and how they've worked out for you. If you've had any issues, please, or if you have questions about the injections, we'll do our best to help you out by getting back to your comments. And please, if you haven't yet, subscribe to our channel and hit that notification bell so that you don't miss out on any of the helpful videos that we post each and every week. I'll see you in the next video. Bye-bye.